If you've been wondering if physical therapy is the right thing to do when you're suffering from vertigo, today I want to go over that with you. Hey, I'm Dr. Gregg Gerstin with the Line Wellness Center, and I've been helping people to remove the blockages from their health so they can lead amazing, fantastic lives for the last 20 years without drugs and surgery. Today we're talking about a topic that's really near and dear to my heart and we've been helping people with over the last 20 years a ton, and that's vertigo. So if you've had vertigo or you know someone who's had vertigo, make sure you forward this video along to them. One of the things that's really commonly recommended for people who are suffering from vertigo is to go through either physical therapy or vestibular therapy or occupational therapy. And for many that can wind up helping with addressing some of the acute symptoms that they're having. They may even take you through one of the maneuvers like the Epley maneuver, and if you've got problems and you want to do a maneuver, check out this video that's helped over 700,000 people with eliminating the vertigo spins here on YouTube, and you could do this at home. But in terms of physical therapy or vestibular therapy or therapy for vertigo, what I've found is that it's really hit and miss. For most people that have come to our office and have gone through rounds of physical therapy for their vertigo, they don't end up far off from where they started, or they may see symptomatic relief for just a couple of months or while they're in therapy. Now the challenge with that, and the reason that happens, is that vertigo winds up stemming from one of four key challenges. And I've done a few videos on it. If you want to check them out, I'm going to share a link to that right here for you. And if we don't wind up addressing the four of them, or actually what I consider to be the key one, then we wind up running into this lap over lap again over again problem. We don't get to the cause of the problem. Now really the key cause of the problem winds up being this part of your brainstem that's called the vestibular center. It helps to keep you balanced, and it helps to it gets triggered when you wind up having problems with vertigo. And if there's too much tension on that area, or if there's too much irregular information going into that area of your brain, then you're going to get an episode of those spins, and they can become more and more challenging the more episodes that you have. So if you're wondering if that may be what's going on for you or how to take care of it, one of the things that I've done down in the notes below is I put a link to a discovery call where we can connect. We can work to figure out what's causing your triggers and figure out how do we wind up correcting that so that you can get back to life. If you've got more questions, go ahead and write them down below in the comments. I always look to respond to them as quickly as we can. Once again, my name is Dr. Gregg Gerstin, and thank you for letting me be a part of your health.